Folks, this is Invest Now America. I'm your host. And as you know, for the past several weeks, I've been doing a great series of local entrepreneurs, Louisville entrepreneurs, and it has been pretty interesting. It's just amazing what I've learned, and hopefully you, my listeners, you've learned a lot. And I want to urge all of you, please, listen to this, listen to these entrepreneurs. If you think that someone could benefit from their service or product, please refer them. Use this interview to do that. And I also want to encourage you to subscribe to the podcast, subscribe to the YouTube channel. Today we have with us Janel Willingham. She is the owner of the Health and Wellness Boutique. And guys, it's a brick and mortar business. It's located at 3103 Breckenridge Lane, Suite 2, Louisville, Kentucky. And we'll give you some more specific landmarks. So it'll be easy for you to go there and patronize Miss Janel Willingham. Sister, thank you so much for being with us today.
Hi, thank you for having me.
Okay. And so let me start off with some real basic, simple questions. What's your product or service?
Okay. My product, well, and I have services and products. I am a board certified family nurse practitioner. I have a doctorate in nursing practice, and I have opened up my own medical practice, but it's not traditional medical practice is what you're used to. I call it a boutique because I want you to feel like that, back to that personal feeling of seeing your provider. But I also enjoy not only traditional methods that we're used to. Of course, I want to help you with your chronic illnesses, but I also want to help you with those things that keep you from getting chronic. So I do things like IV hydration. I sell supplements and other products that add value to your life. And that's the goal, is to add value to life and help you get to your healthcare, your wellness goals, I would say.
You said you have a doctorate?
I have a doctorate, yes.
In what again?
Doctor of Nursing Practice.
Okay. So, it's not like you're some just off the street, knucklehead selling snake oil. You got a significant education background. But I noticed there in that introduction you said non-traditional. Is that right?
That's right.
Well, and so why did you feel a need to sort of go from the traditional, hey, this is the way we do it and the way we've always done it, to non-traditional?
Well, I've been in this for over 20 years. I've been in healthcare for over 20 years, probably really longer than that now that I think about it. I keep saying over 20 years, but it's been really probably going on over around 30 years. Okay. Mm-hmm. So I've been in some form of healthcare along the way, and I've started out as an LPN, and over time I worked my way up to being a registered nurse, and then eventually getting my advanced practice, and then now my doctorate. So I've seen many things along the way. I've seen some things done really well, some things done not so well. But what I've noticed too over the last few years, a lot of the big healthcare organizations have taken over healthcare for the community at large. And that's nothing necessarily wrong, but then I still recognize there's a piece in there that some individuals want. Some individuals don't want to go to the big hustle and bustle of a healthcare organization. Some people want to feel like they still know who their healthcare provider is. And I have those honest conversations, and I'm not afraid that if the fitting's right, and I know you're a praying person, I will pray with you in the room. So though, I don't have those kind of constraints that necessarily I have when I work in a kind of traditional hospital organization, right?
Right.
So that's why
I couldn't agree with you more when you talk about folks wanting to stop feeling like they're just part of a big clog in a machine. They want that personal, intimate care, and they can get that with you.
Yes.
They can get that with you. Now, but what about, healthcare, as you know better than anybody, it's expensive. What kind of payments do you take? Do you take insurance or what?
So I take all the popular insurance plans in town. There's some that I'm still in the works, that some things are out of my control. I'm still waiting for the red tape to clear. But then I also have an option where I have a membership. So you can pay $100 a month if you don't have insurance, and you can get 2 visits a month if you need it, by joining that membership. So that's where it comes in. If you don't have insurance, that's still cheaper. You still can get seen. Now, of course, that doesn't include labs and things like that, but at least that will get you seen. And it's a lot cheaper than most places if you walk in, and you know, it might be $100 just to get in the door, and then by the time they add on all the procedures and tests and other things, and
right.
you know, you got a bills going.
Right. Yeah. No. I mean, you're dead on about that. But look. Who are the people that should see you and shouldn't see? Okay, you know, I got a bunion, or I got diabetes. You know, are there particular types of patients that should see you and others who maybe shouldn't see you?
Okay, so I have experience in family practice. So currently I'm not taking anybody basically around 10 and under, unless it's maybe an acute illness. But I think the children need to go to a pediatrician. And so right now I'm not taking, I can see kids, but I'm not taking them for their wellness visits. Okay. So typically, basically once children kind of get out of the vaccination range, because that's a whole project in itself, maintaining vaccinations. So basically adults that want, if you have diabetes, I can help manage your diabetes. I have people who want to come to me. They may already have somebody, but they want to come to me for weight loss. So I do weight loss. I do primary care, which includes diabetes, hypertension, those chronic illnesses, or some people may want to come to me because they have a sinus infection or their throat, or they got, you know, some kind of pain and they haven't been to the nurse practitioner or physician in years, and they want to get somebody's opinion on which way to go. So I can guide you on that as well.
Mm-hmm. Now, you know, I've many times I've heard that men have a tendency not to go see a doctor as often as they should. Have you found that to be true?
I have, and I find that I try to educate. I find that in the it's even becoming more in the younger population. Like I was hoping as the population gets a little bit younger that maybe that things will kind of change, but I'm not really seeing a change. So whenever I meet a young man, like in their mid 20s, you know, I'm really encouraging them, because a lot of people, and not even just men too, there's some young ladies too, that they believe like, well, I'm only 23. Why do I need to go see a doctor? And I was like, well, you know, you still should go see somebody at least once a year, even if you don't have any illnesses, you're a healthy person, but you need that lab work once a year at the very least, just to check up on things. Are things going right? Or we recognize some things that you may not understand, that, you know, sometimes I walk into a room, I work urgent care as well. And so sometimes I walk in a room and there's things that we can recognize. You may be there for something else, but then I may catch something, right? Or I met one young man at an event, and he had colon cancer rampant in his family, and he was afraid to get a colonoscopy. And was able to kind of coach him through that, what this looks like. Because a lot of times families don't necessarily talk about illnesses completely and honestly. So next thing you know, the younger generation just thinks, oh, grandpa, uncle went into the hospital and they died. Because you know, nobody told them that they've been dealing with the cancer for a year or two or more. They just see that they went in for a procedure, they never came out, and they think, oh my God, I may go in there and I'm not going to come out of the hospital. And so I try to get people to realize, number one, really talk to your family about what's going on. Be honest. I mean, I know it's scary, but be honest. And number two, you don't always know the whole story. You don't know. The information just gets withheld within families, unfortunately, and you don't know the whole story. So most likely when that family member went into that hospital, they didn't just die in that hospital just because like something happened at that moment in that week. Something's been going on for a while to get to that point. Yeah,
I mean, I gotta agree with you about, you know, speaking to the guys out there, you got to go check. I know I was being, from my standpoint, I was being harassed by my sister to go get checked on a couple of things, and finally, just to shut her up, I went in and got checked on something, and the doctor came in and said, "Man, you got colon cancer, and we need to handle this." And sis, doc, I felt fine. I thought he was nuts. How can I have cancer, man? I'm feeling fine, but I had cancer.
Wow.
Yeah,
And
I had cancer.
yeah, you were feeling fine.
Yes. Oh, yes.
I mean, that happened even in my household. My husband, now he was one to go to the doctor, but he was feeling fine, and he had an MRI of his back because of his chronic back issues, and we found out he had kidney cancer. And he was feeling fine.
Yep.
Yeah.
Yeah.
He was fine. So that's why those tests are important on a yearly basis, to see what's going on.
Right. Folks, we're speaking today with Janel Willingham, Dr. Janel Willingham. She's the owner of the Health and Wellness Boutique, located at 3103 Breckenridge Lane, Suite 2, Louisville, Kentucky. Go check her out. Period. I don't feel if you're feeling fine, feeling great, feeling lousy. I don't care. Just go in there and see her, because you just don't know, and it's just really important. Doctor, do you have a website, email address, Facebook page?
Yeah. So I can. I have a Facebook page. You can go under the Health and Wellness Boutique on Facebook. Mm-hmm. You can go to also on Instagram. You can go to the Health and Wellness Boutique on Instagram, or you can go to. I have two Instagram. I have one there, and then I have Dr. Janel, Dr. Janel on Instagram. Okay. And you can find me there, and then my email address is npjwill@gmail.com. That's npjwill@gmail.com. So you can email me. You can catch me on Instagram. My phone number is 502-384-7053. Again, that's 502-384-7053. That's the office number. You can catch me there.
We got about 1 minute left, but I was curious. Where did you get your education? What's your educational background from? The undergraduate level on up.
I started out at the University of Louisville, and then from that point, I actually did a shift, and I went to LPN school. At the time, it was called Kentucky Tech on Chestnut. I did a little long route, but that's okay. And then I went to Indiana Wesleyan for my nurse practitioner degree.
Wow.
And I went to Bellarmine University for my doctorate. So I've kind of been a little bit everywhere, but just to add, when people try to defer your dreams, you just find another path.
There you go.
So that's why my path is a little bit unique, because at University of Louisville, it was a counselor telling me, "Oh, I don't think this is going to happen for you. I don't think this is going to work out." And I said, "Okay, I'll find another way." And so that's what leave University of Louisville and went to Kentucky Tech. And I knew once I passed and became an LPN, I knew that I could do. I was like, I know I can be a nurse. I know I can do it. I don't care what anybody says. This is my calling, and I can do it. And so that's how it started. Great.
And you pushed on to get that doctorate. Now I know that had to have been difficult.
Oh yes, that was a difficult time. But my husband, he pushed me to get that. I admit I was at the time I was not interested at first, but I did it. He pushed me to do it. And towards the end, it was really difficult, because that was the year that we found out he had cancer, and I had, 2 young kids and a lot going on, working full time. And so I made it through, and he got to present my degree to me at Bellarmine's commencement.
Great. Fantastic. Sis, we got to conclude here. Again, Doctor, I really appreciate your time with us. Dr.
Thank you.
Janel Willingham, the Health and Wellness Boutique, 3103 Breckenridge Lane, Louisville, Kentucky, Suite 2. And her Gmail account is now, what did I say? I can't read my own handwriting.
NP.
Will, WILL, at gmail.com.
Correct.
Gmail.com. And, I just want to urge people, please be in touch with her, connect with her. Of course, again, as we just shared a couple of stories there, folks, you just never know. And she's someone who's got developing this close relationship with her patients. And that's very positive in itself, folks. That's you can't really place a dollar value on that. So again, Doctor, thank you so much, and I hope we can do this again sometime.
Yes, thank you for having me.